Hello everyone and welcome again to the Race Academy webinar series, episode 29. Wow, have we just blown through this year? Is really kicked off. It felt like we just started, but off we go to the next topic. So before I get started, congratulations to everyone in the industry for the Australian Dental Exhibition. What a wonderful show. The feedback has been phenomenal and great for the industry to get back together and enjoy their time as a group. For those of you that don't know, the ADX specials will be live until the end of April. So feel free to contact us here at customer support at racedental.com.au and find out what you can get. 30% off Racer aligners still available, 30% off Trials deals, Crown and Bridge deals, and a whole bunch of things there to the end of April. So make contact with customer support at racedental.com.au to take advantage of all those. But let's jump across today to our webinar 29, relationships between bruxism, sleep, nutrition, and cranial facial pain. Now, we've had some pretty cool talkers and some pretty cool lecturers on the webinar series, but the first time we've now got a approved dentist and doctor who's come together to meet us for today's relationship between bruxism, sleep, nutrition, and facial pain. And I must admit, there is a lot of information and questions of people on these topics, and we need to understand exactly how it can affect our sleep, our moods, our health, and brain performance. But Dr. Manish Shah, I call you a doctor twice over, mate. Welcome, and thank you for joining us today for webinar series 29.
Thank you, Matt. Really appreciate your introduction. Hi, guys. Look, I can't see you guys, but I'm going to pretend that I know I can see you guys. So my name is Manish. I have a background in dentistry and medicine, and I did a master's in sleep medicine. So what I'm going to talk to you about today is the topic of bruxism, which is a topic where we see these kind of cases every single day. In case 1 in every 2-3 patients of ours have got teeth grinding or clenching going on. So I've got half an hour to kind of take a 2-hour topic and compress it. And at any point in time, you guys want to ask questions, just direct it to Matt and he'll let me know, and then we'll go from there and answer those questions. All right, so first thing you need to know about grinding. We see this every day in the form of teeth wear, in the form of big muscles, in the form of restorations breaking down, name it, and there's all these signs and symptoms we see, and we know that the patients are grinding away. Now, some of these patients will present with jaw pain, muscle pain, neck pain, shoulder pain, back pain, and some of the patients have got no pain at all. And we just see them bruxing, and then we have to let them know that they're grinding their teeth. Now, we also know that some people grind their teeth in the morning, but the majority of the patients actually brux at nighttime. So the question is, what's the difference? The difference between the morning grinding and the night grinding is most morning grinding is stress related. And I'm going to talk about that stress in a moment. But most of the night grinding has been attributed to a lot of things. There is no actual cause. Nobody's actually found the cause for grinding. What we were all taught at the university was, oh, this person is bruxing, it's stress, give them an occlusal splint, and Bob's your uncle. That's what we've been taught and are still being taught at university. But we have, over the last 10-ish years or 15-ish years, I've now started seeing relationships with certain conditions that are associated with grinding. Now, whether they cause the grinding or not, we don't know, but they're associated with grinding. Now, let's go through them quickly so you can get a basic concept of what is associated with grinding. So if you see somebody with grinding, in your mind, at the background should be going on, do they have these conditions going on? So number 1, sleep breathing disorders. It has been arousals during sleep. So when you go to sleep and you have an arousal, you go to sleep, you get an arousal, go to sleep, you've got multiple arousals. These arousals have been associated with bruxism. Now, what causes these arousals? And the most common cause of arousals is a sleep breathing disorder. There are other causes of arousals, such as pain. If somebody's got body pain, they'll have multiple arousals. Somebody who's got restless legs, like legs that keep on moving around, will cause arousals. But anything that causes arousals will cause bruxism. There's an association, not cause, association. So let's focus on the sleep breathing disorder. Sleep breathing disorders are conditions such as snoring, sleep apnea, whereby you stop breathing over here. And basically what happens is when you choke, you bring your jaw forward and you open the air pipe and you can breathe better. Now, when you're bringing your jaw forward and the grinding happens, and you'll see these patients with anterior teeth wear. Most of the patients you see with anterior teeth wear, straight away, the first thought should be going on, are they bringing their jaw forward? And if they are bringing their jaw forward, are they blocking their airway? And if that is the case, then there is sleep breathing disorder pattern going on. And for that, we need to investigate them and manage them appropriately. The next thing that you can look at is nutritional deficiencies. Now, patients who have got grinding or bruxism going on, and they have pain in their body, it could be either craniofacial pain or back pain or body pain. We term that as fibromyalgia of some sort, which is a disease of exclusion rather than a proper diagnosis. If you have got patients who've got this chronic pain that they're presenting you with, then you have to start thinking, is there nutritional deficiencies going on? Is there gut issues going on if they've got what we call gastrointestinal dysbiosis? Do they have another condition called mitochondrial dysfunction? Now, all these things are related together, these nutritional deficiencies and gut issues and mitochondrial dysfunction. So what does that actually mean? So think about mitochondrial dysfunction first. Mitochondria are the energy creating factories of every cell. You've got trillions of cells, so that means you've got trillions of mitochondria. And what mitochondria does, it takes food from one side and oxygen. So oxygen we breathe and the food we eat goes from one end and comes out of the other end as energy, carbon dioxide, water, and free radicals. Free radicals are like, if you take a car engine, the suit of the black suit that comes out of the exhaust pipe, that's the free radicals that come out on the other side. Now, these free radicals are then managed by the body with antioxidants. The body's natural antioxidants take care of these free radicals. But the energy that is derived is the energy we use in the body to function on a day-to-day basis. So people who have got mitochondrial dysfunction are the people who are always chronically tired all the time. They wake up in the morning tired, they don't have enough energy to do things, or they get tired in the afternoon, or they don't function properly. And they've got chronic pain as well most of the time. So then you have to ask yourself, are they getting the right foods, the right nutrition? Are they breathing properly? Is the engine working properly? And are they producing the right amount of energy or not? So when you've got nutritional deficiencies, these deficiencies means the engine is not working properly, or you're not getting the food to produce the right energy to get the energy to drive for the day, or that's why you're chronically tired. So how do we check for these things, and what nutritional issues can be going on that can allow us to see that they might be causing these issues? Now, if you guys remember from your university days, which is long time ago for most of you, we did this subject called biochemistry. And there was a thing called the glycolytic pathway, the Krebs cycle, the energy phosphorylation cycles. Now, all these cycles generally have a step-by-step reaction that happens, and there's an enzyme in the middle that converts one step to the other step. Now, if this enzyme, for it to be activated, you need a nutrient to activate this enzyme. So one of the most common nutrients that activates most of the enzyme is, for example, magnesium. Magnesium activates a lot of enzymes in these cycles and pathways that happens in the mitochondria and outside the mitochondria. And this magnesium, if it's not present in adequate amounts, can make this mitochondria do not function properly, and then causes no energy production, and that means you're chronically tired and leading to chronic pain because the muscles get tired all the time, so the muscle get muscular pain. And remember, bruxism, muscle pain most of the time, also leading to jaw pain all the time. So nutrients like magnesium, iron, vitamin B2, vitamin B3, vitamin B12, vitamin D. All these are nutrients that are very essential for energy production and muscle function that, if not present, can lead to muscular pain. Now, this topic is quite a vast topic, actually. In my training programs, I actually talk about this for 2-3 hours, but I'm making this talk into a 5-minute talk, and we go in detail as to how this happens. The next thing, the third thing that causes bruxism, which is related to bruxism, is what we have been taught in university: stress. But I must add, stress is not the main topic. It is the emotional response to the stress. So I'll give you an example. All of us run practices or work for people, and we do dentistry every day, and there are always stressful environments that we work with. Either it's the patients or the staff or this, whatever it is that is causing the stress. Whenever there's a stressful input, there's an emotional response to that stress, such as you might get angry, you might get hurt, somebody has said something, or might be afraid that a procedure is not working or a staff is going to leave you and I don't know what's going to happen. So these are emotional responses. Now, when there's an emotional response, what do we do with this emotional response? Now, most of us bury that emotional response. We don't want to deal with it. We don't want to deal with the fear. We don't want to deal with the anger. We don't want to deal with the hurt we are going through, or the sadness, or the guilt we just bury that emotion. And when we bury these emotions over a long period of time, guess what happens to our stress response? What happens to our cortisol levels? Our cortisol level starts rising. Now, everyday stress, cortisol goes up, comes back down after 20 minutes. Just like saliva, when your acid level goes up, saliva neutralizes the acid. Our cortisol goes up, in 20 minutes, the cortisol comes back down. So these are all these stressful responses, and our cortisol goes up and comes down, goes up and comes down. But what if you've got chronic stress every single day, and you just can't manage it, and you're suppressing all these emotions every day? Then what happens is the cortisol level goes up and it stays up, and it keeps on staying up. When that happens, you can actually measure this in the saliva, that your cortisol levels are up. When this generally happens, it changes the way your immune system responds. Now, I'm not going to go in detail, but our immune system has got B cells and T cells, and in the T cells, there are helper cells and NK cells, and lots of other things that go on. But the helper cells, the T helper cells, there are two types, 1 and 2. Now, when your cortisol levels are very high, the T helper cells type 2 get activated over a long period of time, and a person starts developing what we call atopic illnesses. So you'll be allergic to things, you'll get skin conditions, you'll be sneezing all the time, you get hay fever, you're taking all these anti-allergy medications or histamines or something like that. When you see patients like those, you know straight away there's some level of cortisol that is constantly high. They've got high stress levels in their life. Now, what happens if this stress just keeps on going on and on? Your body is producing a lot of cortisol from your adrenal glands. The cortisol goes to your brain. There's a place called the amygdala where there are high levels of cortisol receptors. And the brain basically responds and tells the body, hey, manage this stress. But what if cortisol levels are so high that there's a negative feedback and tells the adrenal glands, hey, stop producing the cortisol. There's too much in the body. Just stop producing it. So when you've got high levels of stress, a time comes whereby the cortisol level just plummets and you get flat, low levels. So instead of high levels, you get low levels of cortisol, but your stress is still high. Now, when that happens, your whole immune system changes to what we call the Th1 kind of immune system, the T helper cell 1 kind of immune system. When that happens, the body starts getting pain, autoimmune disease, and cancers. Remember this very, very carefully. If you've got chronic stress, that where the cortisol levels have now gone down rather than up, these are the patients who start getting chronic pain in the body. These are the patients who get autoimmune diseases, and these are the patients who will get cancers in the body. Now, think logically. What is the function of cortisol? Cortisol is an anti-inflammatory, just like the high cortisol injections we give patients or the corticosteroid tablets we take. It's an anti-inflammatory. If the anti-inflammation is not there, what happens with the body? It gets inflamed. What kind of inflammation? Pain. What causes inflammation? Pain. You get, as I said, autoimmune diseases because our whole body's immune system starts attacking our own body. And the third thing that happens is cancers. Cancers which are supposed to be being attacked by our body's response. The body's response is not there anymore, and you start getting cancers. So these are the patients who have chronic issues going on when you see these patients in practice. So when you see somebody bruxing with a lot of chronic pain and headaches and neck pain and jaw pain, they've been holding their emotions for such a long time that their cortisol levels have been shot dead. Again, you can measure this in the saliva if you really wanted to measure. And that's why they're presenting you saying, hey, I've got headaches and I've got jaw pain and I've got migraines and I've got neck pain and I've got back pain. And that's why we have now been associating chronic pain with stress disorders. And the analogy I tell my patients is, imagine you're swimming in a swimming pool with beach balls on the water, and each beach ball is a emotion for a particular stressful situation in your life. And every time you have a stressful situation, you take that emotion and you bury in the water. And you take another beach ball and you bury it in water. And every day you're burying these beach balls and you're holding about 10 or 15 of them. And then you're struggling to hold them. And one day you just let go. And when you let go is when you start crying or you burst out in anger or rage. And then again, the whole cycle starts again. Now, I can't see you guys. I wish I could ask you a question. How many of you guys go through this every day? And I'm sure most of us in our profession go through this every single day, whereby we get tired in the evening or tired in the afternoon with stress levels are so high. And we are burying all these emotions. And then we come up with these chronic situations. So, breathing problems, nutritional deficiencies, emotional response to stress. 3 major causes of grinding, or not say causes, relationship with grinding. So if you see a patient from today onwards and you see that they're grinding, figure out, are they grinding during the night or the day? Are they with pain or without pain? And if they're with pain and they're chronically having pain, have they got high levels of stress in their life? Are they burying their emotions in their life? Have they got nutritional deficiencies possibly going on? And again, we need to train you how to just examine them and you know there's nutritional deficiencies going on. And have they got sleep disordered breathing? And how would you pick out sleep disordered breathing? So I'm going to teach you this by a very simple method. The first thing I would like to do is ask a history, which has got 3 important questions. Question number 1, if you want to write this down. Do you wake up in the morning feeling tired? And if somebody says yes, then you know that they are not sleeping properly. But if most people will say actually, no, I don't wake up in the morning feeling tired. So I asked the second question, such as, but do you wake up in the morning feeling fresh, like ready to go? I'm so happy. I've had a fantastic day today. Look, I've got so much energy. And the answer is no to that. Then you know that they're actually not having a good quality sleep. The second question you can ask is, do you wake up at night to go to the bathroom? Now, this is an important question because when you stop breathing, generally what happens is your heart rate increases. When you stop breathing, there's no oxygen going in. Your heart rate slightly elevates. When your heart rate slightly elevates, your blood pressure in the system slightly elevates. When your blood pressure in the system slightly elevates, the whole body is designed to decrease that blood pressure. And how does that happen? The kidneys suck out all the water from the system. So all the pressure in the pipes go down when the water is sucked out from by the kidneys. And when the water is sucked down, it collects in the bladder. And when you have that micro arousal, when you stop breathing and you choke and you just micro wake up, you realize your bladder is full. So you wake up and go to the bathroom and come back and go to sleep. And that's why the second question is important. Do you wake up at night to go to the bathroom? And the third important question that I ask is, sorry, I'm getting a mental block. Yeah. Do you get any headaches, neck pain, jaw pain, all that kind of stuff? If you ask these 3 simple questions and your answer is yes to any of these questions, then you straight away know that these people might be suffering from a sleep breathing disorder, which is inclusive of snoring, sleep apnea. So if sleep apnea is up here, snoring is here, there's a middle condition called upper airway resistance syndrome. I'm not going to go in detail about those conditions, but these are the 3 sleep breathing disorders that can cause tiredness in the morning and can lead to potential bruxism. Now, the next step is the patient has said, yes, I do wake up in the morning tired. I am grinding my teeth. I do have headaches. I do wake up at night and go bathroom. Okay, what's the next step? What do we do? So when I'm doing my training program, I basically teach the dentist how to actually order what we call a sleep study, or work with sleep physicians, or you can order sleep studies by yourself to figure out, have they got a sleep breathing disorder? And the second thing I ask is whether, if they have an obstruction in their air pipe that is causing the air pipe to narrow, that is leading to the sleep breathing disorder, where is that obstruction? Is it in the nose? Is it behind the top jaw, behind the bottom jaw? Is it in the throat? Where is that obstruction going on? So we can manage them accordingly. So that leads to the management. How do we manage bruxism? Somebody is bruxing. We have been taught, give them the occlusal splint. Now, I'm not sure whether most of you are aware of this, but if you give somebody an occlusal splint, the current research shows that 25% of those patients that you've given an occlusal splint to increase their bruxism. These are the patients you will see that they'll come back with a splint and they've got marks on the splint, or the splint is broken, or they're fractured, whatever they've done. But these are the people who actually increase their bruxism. In 50% of those patients you've given an occlusal splint, the bruxism remains the same. It doesn't even go down, doesn't even go up. It remains the same. And in 25% of patients, it goes down, but it doesn't eliminate it, it just goes down. So in essence, if you give anybody an occlusal splint, a bruxing splint, they are still going to be bruxing. So if they've got jaw pain, so these are people who have come to you with jaw pain, neck pain, head pain, and you give them a bruxing guard or bruxing splint or occlusal splint or a Michigan splint, whatever you want to call it, these patients are not going to get better most of the time. Sometimes they will, but most of the times they won't get better. So then what do we do? So the research is showing now that if you give them a mandibular advancement splint, so a splint that is a top and bottom and brings the jaw forward, that decreases or eliminates bruxism completely. That also helps with the pain. That also helps with their sleeping. So giving them a mandibular advancement splint is a far more superior treatment than giving them an occlusal splint. But to give somebody a mandibular advancement splint, it is wise to diagnose whether they have sleep apnea or not. Because if they do, you're then killing 2 or 3 birds with one stone. The next thing we can look at is a nutritional deficiency. Now, I've got patients, I see a lot of craniofacial pain patients in my practice. And in some instances, I just give them high dose magnesium, just magnesium. And within 2 weeks, the pain's gone. So they were just magnesium deficient. Now, these are patients who are in chronic pain. They've got pain in the whole body. Women generally would suffer from very bad menstrual cramps. Men would have calf pain, or women would have calf pain. They would have neck pain, jaw pain, head pain, migraines of some sort. By just giving them magnesium, and the best magnesium, by the way, just for reference, is magnesium glycinate. Glycinate is the best to give, followed by citrate, citrate, citrate. So magnesium glycinate, magnesium citrate at a dose of 10 milligrams per kilogram. So if somebody is weighing 60 kilograms, you give them 600 milligrams. If somebody is weighing 80 kilograms, you give them 800 milligrams, divided in 2 doses. So 600 divided by 2 is 300 morning, 300 night, 400 morning, 400 night, depending on what they need. If you give them high dose magnesium, it will help them to relax muscles. Now, magnesium has got 400 different functions in the body. One of the functions is to relax muscles. Calcium contracts muscles, magnesium relaxes muscles. Remember that. If you can remember that, calcium contracts muscles, magnesium relaxes muscles. In fact, even for high blood pressure, if somebody's got really high blood pressure, or somebody is pregnant and they've got eclampsia, which is high blood pressure during pregnancy, the first thing they give is magnesium sulfate, IV. Why? To relax those muscles. Magnesium is a very, very important element to relax muscles. The second thing magnesium does is improves your sleep dramatically. So somebody's got a sleep problem and a pain problem, and you give them magnesium, they will improve quite considerably, apart from the fact that you have to fix the cause of the problems as well. And the third thing is the emotional part of it. Now, most patients who've got chronic pain and bruxism going on, if they've got the pain, then it is wise to discuss with them whether they would consider seeing a therapist. If they can consider seeing a therapist, and a therapist who is trained in teaching them how to deal with the emotions that they're burying, if they learn how to deal with those emotions, they will stop their grinding. If you treat the sleep breathing disorder and the nutrition, but do not treat their emotional responses, they are not going to get better. And trust me, I've been doing this for 15 years. I see hundreds and hundreds of patients every year with pain. And my experience has taught me that the emotional component, apart from the body component, is very, very important. So hopefully today, you guys can get a lot out of this management of bruxism. Now, there might be a question that say, hey, can we use Botox? Now, there are quite a few patients who've got Botox deficiencies. So if they've got a Botox deficiency, and I know it's a joke, but you can put Botox in there. But what if you are to put Botox in these mesenteric muscles and the temporal muscles, that's where I give my Botox. The biggest side effect of giving Botox is they can't move their jaw forward. And if they can't move their jaw forward and they have a sleep breathing disorder, then you're going to worsen their sleep breathing disorder. So if you feel that you are a person who does Botox patients, and now you've learned something new that you should get them checked for a sleep breathing disorder, I would recommend that you check them for a sleep breathing disorder before you give them Botox. So I Botox a lot of patients. And if they have a sleep breathing disorder, I would give them a splint, which is a mandible advancement splint, as well as the Botox. Or I would Botox them if they do not have a sleep breathing disorder and they've got bruxism going on. I hope this talk was helpful. And if there are any questions, if you ask, this is a huge topic, and I've tried to compress it in like literally 25 minutes to 30 minutes. And in a training program that I give, it actually lasts for an hour or two, this topic in itself, in my program. If there are any questions, I would like to hear them and I can answer them if possible.
Yes, Dr. Shah, we do have a few coming in now. And I just wanted to reiterate before we get into or not reiterate, but just comment before we get into the questions. The topic and your presentation was brilliant. Thank you. The interest we're seeing here from Australia, we got registrants from New Zealand and Singapore, Malaysia, the United Kingdom, Japan, and India. So you can see clearly it's a topic that is not only reliant on information in Australia, but all over the globe, mate. So welcome to all of our guests all over the place. The questions are still popping in. I'm going to jump straight on board, Manish, if I may. First, regarding some bruxism, if you have a patient showing clear evidence of bruxing, but they insist they don't, how is it best to demonstrate they need help?
All right. So if a person is not, this is just experience talking, nothing else. Okay. If a patient says, no, I don't have any problems, I don't feel anything, and I don't want to do anything about it, leave them alone. I would highly recommend leave them alone, because the moment you start instigating the fact that you have a problem and you should be thinking about it, or you need to do something about it, if something goes wrong, and inevitably in those patients something will go wrong, they will blame you that I never had a problem and you created a problem. Saying that, if you ask those questions about the sleep breathing disorder, so you ask them about questions about pain, you ask them questions about whether they've got gut issues, if you ask them about patients about whether they wake up in the morning feeling tired, if they're fresh or not, and if they're saying, they're giving answers which are relating to the problem, then say, look, would you like to fix that? Because that's what's probably causing the grinding of your teeth. So they're not focusing then on the grinding, they're focusing on the fact that they are improving their sleep, we are improving their health, general health. That's one way to approach it.
Right. Mate, if calcium contracts muscles and magnesium relaxes muscles, would it be problematic if the patient takes both?
No. So if they've got, so different patients, different age groups, different requirements. Now, patients who are older will have osteopenia or osteoporosis. They have to take both calcium and magnesium. Just for reference, both calcium and magnesium is stored in our bones. And both calcium and magnesium, when you measure it in the blood, which we normally don't, is always normal in the blood, always. Why? Because magnesium and calcium has to have a homeostatic effect or balance effect in the body And the way, if your body is low in magnesium, it will leach it out of your bones. So you'll see younger patients with osteopenia. So because the magnesium and the calcium is being leached out of the bones to keep the balance in the blood. So it is, if somebody's taking calcium and magnesium, no, there's no issues. It's not just muscular activity that they deal with. There are lots of other activities, hundreds of other activities they deal with. And so patients who are older will have 4 things that they'll be taking: vitamin D, vitamin K, calcium, and magnesium. These are the 4 nutrients that are essential for bone health. And older patients will most probably be taking all 4.
Okay, and the benefit of having a practitioner's a medical practitioner degree there, Manish. So thank you for that information. Are these prescriptions safe for us to recommend? And I'm assuming they mean dentists.
Yeah. So these are not prescriptions; these are just nutrients over the counter. So you are basically giving nutritional advice. Now, we are dentists, so we are allowed to give nutritional advice. I'm not sure whether each and every country has got different rules, but of course we can give nutritional advice. We always giving fluoride in their teeth for their teeth. So we can give magnesium, we can give calcium, vitamin D. But if you think like you are not comfortable doing that, you can ask their GP to help. But there are lots of GPs who do not want to listen to dentists. So there's, you got to look, just, it's a harmless thing to give magnesium, calcium, vitamin D, and vitamin K. It's nothing complicated. Yes, it is important. And there's one pearl I'll give you. Vitamins A, D, E, and K. Remember the ADEC chairs. Remember ADEC chairs, okay? Vitamin A, D, E, K, ADEC. Those are fat-soluble vitamins. You cannot overdose. You should not be overdosing it. Those we should kind of be taking in a moderate dose. But vitamins B's and C's, you can overdose and nothing's going to happen to you. Generally speaking, I'm just generally speaking, okay? So yes, we give vitamin D and K. There are doses from 1,000 units to 5,000 units for vitamin D. And for vitamin K, it's 90 micrograms per day, if you want to give them. By the way, one other clinical pearl: if you see somebody developing calculus in their teeth regularly, like you've cleaned them and a month later they've got lots of calculus, those are the patients that have got very low vitamin K. Vitamin K2, to be very precise. Vitamin K2 has been associated, if you've got low vitamin K2, calcium deposits out of bodily fluids. That means out of the blood, out of the saliva. So in terms of the heart, you get calcifications in the arteries, calcifications in the carotid arteries. In the mouth, you get calcification, you get salivary, you get calculus formation. This is a sign that says that you've got low vitamin K in your body. So by giving them vitamin K and vitamin D, these are clinical signs and symptoms I've got to teach you. But again, as I said, it's a big topic in itself.
Wow, that is most interesting, Manish. Thank you. Is there TMJ long-term issues with advancement splints?
All right. So theoretically, 10% of the patients get a bite change with a mandibular advancement sling. Theoretically. In reality, it's about 30 to 40% of patients will get a bite change. So the question is, how do we prevent this bite change to happen? So most patients are given another device called a morning repositioner appliance. So when they wake up in the morning and they feel that the bite is not meeting and they're slightly changed, they wear this morning repositioner device for about 5 or 10 minutes and gently chew on them, like as if you're chewing a gum, just gently. And that resets the mandible back to the normal position 99% of the time. 1% of the time that would not happen. Now, these are the patients who got a severe class 2 DIV2, their bottom jaw is so backwards that you're bringing it forward, they will not want to go backward. They'll love this new position. But then the back teeth are not touching, so they will need orthodontics. So every patient of mine, I do warn them of potential, especially the class 2 DIV2 ones, of potential orthodontics in the future. And they know about it anyway. They know their jaw is backwards. They know they've got issues. So they are pretty accepting in the treatment.
That's interesting to know. And I guess for those patients that have taken advantage of advancement splints over the long term, there is 30% off race aligners, mate. We might be able to resolve that for them. But look, we have run low on time, Manish. I do have one last question here. After 25 years of experience being a practitioner, do you prefer dental or medical?
Definitely dental, guys. Definitely dental. There's no doubt about it. Dentistry is the best. I mean, I did 5 years of med school, and I must say, thank God I did dentistry. That's what I think.
Oh, look, it's great to know. Your information has been fantastic. A lot of people do, well, those topics do mesh a lot, Manish, and it's difficult to know if it's a sleep disorder, if it's a bruxing issue, or craniofacials you mentioned, or even nutritional. So that information has been good. A few people have been asking for the recommendations. So this will be live again. The recording will go live in the next day or two from our marketing team. Will have that live at racedental.com.au under the education component. So for those people asking for that information, and no doubt the glycemate magnesium at 300 milligrams per kilo morning and night.
10 milligrams per kilo, mate. 10 milligrams per kilo.
This is why I leave it to you guys. But the information probably best watched again. But feel free to jump on board in the next day or two and watch this again for that information. Manish, it's quite normal for me to throw everyone under the bus at the end. So if you were to try and find, I know there's a lot of information there that you could have extended on for 2 days. But with regards to bruxism, sleep nutrition, and craniofacial pain, I'm going to let you just elaborate on one last point that our clinicians could take home.
All right, guys, this is a topic whereby we see patients every day. We do have a regular dentistry every day. Most of us are not interested in doing TMD related stuff. But if you start just observing this, and it's just very basic stuff. Well, it's basic for me, but it's very easy to do this once you learn how to do this. And once you learn how to do this, it will be like a no-brainer. It will be just like doing a filling. I guarantee you that. When I first started doing it, I thought it was going to be difficult, but if you follow step by step, it's so easy. It's nothing difficult. And I'm just going to, so sorry, Matt, if I may say so. Look, there is a training program that I do. It's a 6-day training program, but 2 days over 3 weekends, about a month to 6 weeks apart. So you can literally get properly trained, and you will see a patient, and within seconds, you will know what's going on. Literally within seconds. You can just look at the patient and you will know what the problem is, how to approach it, how to manage it, and how to look after it. And it will be the best thing you'll ever learn on this. If you're interested in learning more than your regular dentistry, and this is the way to go.
Okay. Have you got some information you could put up for that, Manish?
Yeah, it's if you just go on the website called drmanish.com. With the doctor, it's DOCTOR, drmanish.com. And you got all the information there.
Well, thank you again. I do appreciate it. And I'm hoping a lot of these clinicians will be up and running at your practice or in your courses to learn more about it. Such an interesting topic and so highly in demand from all the countries that we see people here from. But again, for anyone who's interested to go to our customer support team, the information on race aligners, lab products, intraoral scanners, mouth guards, race rewards, the customer support portal, and other, feel free to make contact at customersupport.com.au. Manish, again, we've run out of time. Thank you so much. We appreciate you joining us.
Thank you so much. I really appreciate it, and I hope everybody enjoyed the talk. I know it was quick.
And it is difficult. I know how difficult it is to compress, mate. So thank you again. We thank everyone for episode 29. Join us next month for episode 30, and stay safe. Happy Easter. We'll see you all soon.
Thank you. Bye. Bye.
Bye.